Welcome to CDP's podcast, Practical for Your Practice,
where we give you actionable intel to support what you do, one colleague to another.
Hello, everybody, and welcome to Season 8 of Practical for Your Practice.
Season 8?
Season 8.
Isn't that great?
No.
No.
I mean,
We're
it is, but
skating into Season 8.
Season 8 is great. There's no debate.
Oh, okay.
Wow.
Enough already.
Well, welcome to the debut of Jenna's rapping career.
I have In Excess to thank for this.
Oh, yes. That was part of our discussions about a theme, is like we kind of riff off of their, what is it, Mediate song?
Mediate.
Yeah,
Like
from yeah. Oh, wow.
Anyway,
that was an 80s flashback.
Here we go.
But yeah, so welcome back. Like this, who thought we would be going on this long, saying, having things interesting to talk about and to say, and all the great guests we've had. But this is the 86th episode of the podcast, and
That's wild.
I'm amazed that it's gone so well. So thank you, everybody who's listening and who's listened to others. Like, welcome back. Thanks for sticking with us and being part of this community. We're so excited to be here again for another season. So.
It's very exciting. Before we go on to Season 8, can we reflect back? We had a listener from Season 7 reach out to us with an amazing email that I would love to read, if that's okay with you two.
Yeah, please.
Commenting on our self-care episode.
Okay, that was what, episode 11?
That was episode
Season
11.
7. Yeah.
Yes, it was episode 11 of Season 7. So I'm just going to read it.
Go for it.
So this email came in from Danielle in Andover.
Hi, Danielle.
Hi, Danielle.
Hi, Danielle.
Sorry, you're right. We messed that up. Hi, Danielle. This episode was exactly what I needed yesterday. Stress cubed is definitely the vibe lately. Just wanted to share some things authentically that have been serving me very well. Over the past year or so, I have moved to anchor appointments. I see my chiropractor and acupuncturist biweekly and schedule my monthly massages out 2 months in advance. I need you in my life. This has really created a sense of normalcy and regularity for me, guarding that time to refill my bucket. I also returned to therapy in January after a 15-month break. Good for you. It helps me to be such a more well-resourced human parent, partner, and coworker. Highly recommend for everyone during these trying times.
For sure.
I have also started scheduling a weekly nothing day. This is my favorite part.
I love it.
I've also started scheduling a weekly nothing day to give myself the freedom to do nothing that feels like work. Rest is so incredibly productive, and even if it isn't, does every single minute of my life need to be productive? That's a great question. I need to ask myself, Danielle. Thank you for all you do to make CDP great. Listening to Practical for Your Practice is often such a bright spot in my day, Danielle. So thank you, Danielle,
I love it.
For those great ideas. I mean, in addition to kind of reflecting on the thinking the episode really had her reflect on those great things she's doing. I love that she shared specifically what they are, because I want to adopt a nothing day.
Oh man,
I have. I've done a nothing day, but I've done it monthly, and I think she's inspired me to do it more frequently, because I concur. It is so restorative.
I will say that's the way the first thing I reacted to was, I was like, weekly? I don't know if I have time for that.
I pick Monday. How many meetings do I have that day? I'm just going to have
exactly.
That's really cool to get a reaction to that episode, because as I recall, that episode was sort of a last minute decision of what do we want to talk about. Corinne wants to talk about the fact that she's overwhelmed, so let's talk about that. I guess I think it's testament
to the how I don't know, universal or at least ubiquitous that feeling is. So
yeah, and the authenticity, I guess, of us sharing our stories resonated, which is very cool. So thank you, Danielle from Andover.
Yes, Danielle.
Thank you. Well, that's a great way to kind of send us into a new season, I think, is reflecting on. That was not the only awesome episode. There were a ton of, I think, really fantastic episodes in season 7. So if you haven't listened to all of them, or you want to go take a look at what was there before, pick up ones that you missed, please do. I mean, they're all in the the archive, I guess, in whatever platform you're listening to us on. And so with that as a springboard into
Hmm.
season 8, as we said,
Boing.
Which is great.
which
Now you
is
don't have
great.
to insert a sound effect.
Jen is our sound effects. That's the
Boing.
theme, is that Jen will be our sound effects generator for this season. We've been thinking about what we can focus on this season, right? So we started basically way back in season 4, having a theme throughout a season where we would ask each of our guests to reflect on, a particular question or a particular theme. So we started off in season 4 talking about EVP confessionals, right? So people who
Mhm.
are generally experts in evidence-based psychotherapies, also kind of confessing, if you will, how things didn't go well, or how they messed up and how they restored that, just to kind of um, normalize the fact that you don't have to be perfect to be
Mhm.
effective, and that we can recover. Right. Season 5, we talked about what is your why, like reflecting on what's our reason for doing this work. Season 6 was about who's got your six, who's got your back, who do you lean on when things get tough. And of course, season 7's, and we returned a little bit to that season 4 topic of
Mhm.
confessionals, if you will, by talking about EVP sins. What are kind of the most common errors that either new practitioners make as they're learning to offer, learning to deliver EBPs, and how do we, correct those? But kind of again going a little bit into, let's be a little vulnerable. Let's talk about some of the stuff that hasn't gone well. This season, we wanted to change focus a little bit, or at least shift our focus in another way.
That's why we were going with Elf this season, right? Because we decided we were going to shift. Am I remembering that
Right. And
correctly?
and you left out like the most important part of season 7 was,
That's right.
an
I
homage
did. Oh,
to
I'm
the
so
movie
sorry.
Seven
No,
and Corinne and her favorite movies. So if we're sticking with,
right.
Corinne's favorites driving it, this
Right.
season is Elf, right? We
This is
like,
Elf. That's what we decided,
yeah,
right,
we said
Kevin?
at
Right.
the end of
Right.
season
That
7.
is right.
Yeah.
Absolutely. So I'm not sure how we're tying it to Elf.
Candy canes.
Yeah. And syrup or something, right? So
Yeah.
we're gonna be syrupy and sugary all season. No, that's not quite it.
That's not it.
No.
All
But
right, let's just do something different. Go
well, I
ahead.
mean, here's the crossover, perhaps, and that Elf was a feel good movie, right?
Mm,
Elf was one of those that just it
Oh,
was.
well
It,
played, Kevin.
thank you.
he's a
It
pro.
it was one where there was troubles, right? But you really found the good in people at the end, right? Am I capturing this
Yeah,
okay?
yeah, yeah.
Okay.
Mm-hmm. Mm-hmm.
So the thought is, for season 8, we want to talk about when things go right. Like, what are some of those experiences that each of us have had, and all of our guests will ask them too, that that are the successes, the things that were deeply meaningful to us or impactful on our careers. And we in some ways we kind of want to make a segment of each of those episodes talking about a story time. Just like, tell us a story
Mhm.
when you had an experience that went really well or that was meaningful to you. Um,
And
and
those
and
could be two different things, right? Like that
absolutely,
often they're the same, but there could be something that's impactful that's not necessarily a success,
yeah,
but is
Right.
good
meaningful.
point. Yeah.
Impactful moments.
Yeah, if you
Impactful
will.
moments. Maybe that's how we'll capture that, as impactful moments. Because we want to remind ourselves too that even when things are tough, even when things didn't go perhaps the way we expected them, even when, man, like that episode in talking about self-care, that even when we're all kind of trying to survive, there are those moments that stand out, that are positive or meaningful, or something that kind of keeps us going. So, and
Maybe
one of the
even
things,
shape how we do things from then on as
yeah,
well. Like,
Yeah.
sort of shifted or shaped us in a way that was meaningful and impactful.
yeah,
Yeah.
yeah.
Because we have cognitive bias, right? Like we're just as guilty of it as our clients
Mhm.
to like look at deficits or when things aren't going well or, sort of the banal stuff. So like taking a minute to really reflect on how have I been, moments that have impacted me and if that includes a success, that's great.
Yep.
Yeah.
Agreed.
So I like to picture this season as like story time with P4P, and we're all gonna like pull up our carpet square and
Oh, that's
sit
right.
crisscross applesauce and
Oh, I like it.
tell stories. Now you know how old I am
Do
because
we,
that I lived in that time where we pulled up carpet squares
are
in
we like
kindergarten.
bringing a pint of milk and taking a nap
Cookies,
afterwards? Because I'm okay with
cookies.
that.
Yeah, for
Yeah.
sure.
Well,
Well,
cool. Well, so to kick us off with story time,
Mm.
for with P for P, talking about those impacts, those meaningful experiences. Anybody want to volunteer to share one?
Hmm. Well, I'll volunteer to go first because I've had
Okay.
since we came up with this idea, I've had an experience that's been on my mind that I keep remembering that was really meaningful to me. And part of the reason that it was meaningful is that I had no idea in the moment that this experience was going to be useful to anybody. And so it kind of surprised me more than
Mm.
anybody in terms
Yeah.
of how it played out. So a little like backstory or a little history context is that this comes from when I was a psychologist within the VA, and that was many years ago at this point. I don't know if it's still the case, but back then, doing compensation and pension evaluations
Mhm.
was an unenjoyable part of the job. So it was this nobody that I knew enjoyed doing it. It was a necessary evil where or at least it felt that way, where as a psychologist, I was doing interviews for veterans who are applying for compensation disability for a mental health condition, most often PTSD.
Can I ask, like, I'm curious because I did my internship at the VA, but we didn't do comp and pen evaluations as internships. So I'm kind of curious. I've heard this from other folks that have done them as well. What is it about doing comp and pen evaluations that are difficult or is
Ugh.
unenjoyable?
Thank you for asking that because I think that's important to know. And again, this is from my experience years ago, so it may have changed, and I hope that it
Okay.
has changed. But back then, there was number one, a lot of time pressure. So I was doing like four
Yeah.
assessments in a
Mm.
day. I was basically just at the clinic 1 day a week doing this. So four assessments a day. There was a structured interview that had to be
Oh,
done, like lots of yes and no questions. And you have, in the worst case scenario for me as a psychologist, you have a veteran who is, for the very first time in their life, disclosing a traumatic event. And
yeah.
as a psychologist, I'm like, cool, stop talking because I have to ask you the next question. I only have 45 minutes and we have to get through these questions. So I'm like, kind of,
Mm.
it's the least empathic feeling thing.
Okay.
Okay.
And
Yeah.
add to that that there's a lot of pressure, on the veteran who maybe really needs that disability status to go through.
Oh,
And at least where I worked, they were often receiving a lot of messages um, preparing them that the examiner, me, was going to be difficult or not believe them. So they were coming in with a
man.
very contentious expectation. So it was just a really negative experience. And
Like a
I
very hard
dreaded
setup.
it. And it felt so untherapeutic, right? Which is the
Yeah.
exact opposite of why I'm doing what I'm doing. So thank
Yeah.
you. That
No.
context is important. So I was doing those exams, and one day I'm in the clinic, and the front desk staff says, "Oh, so and so, Joe Smith has been looking for you." And truly, I'm like, I don't know who Joe Smith is. I have no idea who Joe Smith is. Who's Joe Smith? Joe Smith
That
is
could
a
be a little
veteran,
scary.
right? And Joe
Yeah.
Smith is a veteran. You did a CNP exam on him, and he's looking for you. And I'm like, great, this is going to be awful. Please, please don't tell him where I am. Like, I'm imagining, okay, so he didn't get his disability
Okay. Yeah.
status, which has nothing to do with me. Like, I don't make that determination, but he's mad at me. I don't know who this person is. And
Yeah.
this went on for a few days that Joe Smith kept looking for me. And then one day I had my office door open and in walks this person who I do not recognize, but I assume to be Joe Smith. And I'm now like in this tiny office in the corner. And this person comes in and says, Dr. Lefkowitz, I've been looking for you. I've been
Oh
trying to
my
talk to you. And
gosh.
I'm like inching towards my alarm button, like,
I
oh
was gonna say, do you have
no.
a
Right.
panic button
Yeah,
in
I
there,
have a
right?
panic button. I'm inching towards it. Like I don't know who and truly I feel terrible because I didn't remember him. I'd done so many exams, week after week
Yeah.
after week. I didn't remember him. And he starts crying and he says, "Thank you. My disability went through. It's because of you."
Oh.
Which it was not, by the way, but like he took it that way. It was because of you. And now, like, I'm gonna get money in and I can pay my mortgage and I'm not worried.
Oh,
And I feel like I was, listened to. And again, I part of what felt so impactful was I didn't even remember him. I couldn't tell you anything about his story. To
yeah.
me, it was just a thankless job that I
Yeah.
was
Mm.
doing
Yeah.
that didn't feel like anything good was going to come of it. And then I had this incredible experience where somebody, was really impacted because
Yeah.
yeah,
Like,
yeah,
and really reflected on how essential and important that work
Yes.
is and the
yeah.
meaning in his life.
Yeah.
That's
Well, and
incredible.
I was thinking the similar thing, Jenna, right? Like, I think sometimes the reputation among some of the veterans that we meet is that, care at the VA maybe isn't what they're hoping for, or sometimes feel like it's such a bureaucracy, maybe that
Yeah.
somebody's not listening to them. And I don't think that that's the common thing at VA. Like
Right.
I did my internship at the Portland, Oregon VA, and that was my only time working for the VA. But my experience was that, it's full of providers who are trying their best and trying very hard to serve the veterans in front of them and really working for good outcomes on their behalf. What an awesome experience for a veteran to reflect that, man, I felt listened to,
Yeah.
where sometimes the prevailing story is, you get in there and nobody's listening to you, right? Like,
Right.
that's awesome that
Right.
they had that
Yeah.
experience and that you got to be part of it.
I was gonna say, how did that, it's an amazing story. How did that impact you? Like, how did that shape? Because you had to continue in that clinic and
Hmm.
you probably continued have done things since then. Like, how do you feel like that did impact you?
In so many different ways. I mean, like in the context of CNPs, it made me slightly less dreadful of the experience, like feeling like, okay, I actually can potentially be helping people, and maybe I'm not coming across as unempathetic as I feel in this
Yeah.
in this
Yeah.
context. So like it was great in that situation, but more broadly, it really helps me to remember that there are times where maybe you're doing a task that you don't like in that case, it was basically assessment. I was doing a task that doesn't feel essentially rewarding all the time.
Yeah.
Or maybe you feel like you're not making progress, but you never know what impact you're having. And it could be the simplest thing, the simplest statement that you're making that ends up having a huge impact. So being I guess, a little bit more hopeful about what we're doing.
Yeah.
I
That's
love
one of
that.
the things I love about us doing this theme this season, right? It's just that idea that sometimes the things that maybe don't seem to us as the most impactful, you know, really can impact people's lives and their outcomes and their functioning
Hmm.
in ways we didn't maybe understand.
Hmm.
It reminds me of
Susan,
kind of the
yeah,
story I was thinking of, to be honest.
please. I was going
And
to ask, does anybody have a similar story or?
yeah, and in fact, some of the elements, this is what reminded me of it. It's like listening to your story, going, "Oh yeah, I had something kind of like this." It wasn't in the context of comp and pen evaluations. It was when I was working at an army hospital, in their behavioral health clinic, and really focusing on PTSD actually. But of course, you see lots of things that come through that clinic. But and at the time, I was relatively newer, working there. And probably, certainly earlier in my career, certainly earlier in my prolonged exposure therapy days, I didn't at the time really consider myself, expert necessarily at it, or very experienced at it.
Hmm.
Um, but in this particular situation, the client was a special forces guy, and this is early in, kind of, we called it GWAT at the time, like Global War on Terrorism, right? So OIF, OEF was going on. They were, the military was hiring a lot of psychologists to be available for helping service members. So kind of plussing up quite a bit to help service members that were deployed and serving in that. And this particular person was in special forces, and they had been deployed, I think, 3 times prior to that, which at the time was a lot. Like,
Mm-hmm.
it
Hmm.
was like one of those
Yeah.
where you're like, oh my gosh, I'm seeing somebody that was deployed 3 times. These days it's kind of like, well, yeah, everybody's deployed 3 times. What's the big deal? But so when he came to see me, he had gotten orders for a fourth deployment and was really nervous about it, and really came to see me not as I need to get out of this, but more of like I don't know if I can do this because of the experiences that I had in my
Yeah.
previous
Yeah.
3 deployments, and some really, really horrific stuff. And so, as of course did kind of did all the intake assessment and all that stuff. We did kind of, diagnostic work and treatment planning, and agreed to do some prolonged exposure therapy. We were going to have just enough time to do a full course of PE before it was time for him to deploy again. And I'm thinking this whole time, like, gosh, what are we doing here? I like almost felt like, do you remember MASH, where,
Yeah.
some of the prevailing concern was like, we're just going to be patching these guys up just to send them
Hmm.
back to the front lines again. Like, what is the purpose of this? And I had a little bit of that feeling. Like,
Yeah.
I feel like we're just going to be patching this guy back up just to send him back out to the front line. Like, do I need to write a profile to prevent him from deploying? Is that really my job? Really part of what we're doing here is to help people be the healthiest they can be so that they can do the job they've been trained to do. And anyway, lots of, thoughts about what is a good outcome here. And it was tough work. Like this guy had been experiencing lots of different traumas over multiple deployments, and it was really heavy work. And I really often wondered, how well I was serving this person. His symptoms were
Hmm.
significantly reducing, which was a double-edged sword because I'm worried, okay, well now he's going to deploy again.
Hmm.
We don't really have a good
Mm.
justification to prevent that. Again, a little bit naive because in my mind, somehow I thought maybe that would be good for him, right?
Yeah, right.
Right.
So anyway, worked for a while. We completed PEs, doing a lot better. He's going to get deployed, and that's it. Story's over, right? Except that for a lot of folks we work with, we never hear the rest of the story. We hope they do
Right.
well, they move on.
Hmm.
But similarly to you, Corinne, like in the next year and a half, I ended up moving to a completely different agency. I went and moved to this. I mentioned it on here before, the National Center for Telehealth and Technology. Was
Hmm.
on the same installation. So I'm on the same base, but in a different building, different part of the
Not in the
base,
clinic.
not in
Yeah.
the clinic. And I get a phone call from the clinic one day and they're like, so and so is here to see you. And I'm like, that's funny. I don't work there anymore. And so
I don't
I don't
have a
know why you're telling
template.
me this. Right, exactly. So they're like, no. He says that he saw you before. I'm like, before. And like you, Corinne, I'm like racking my brain, like, who is this person? I have no idea who they are. I'm like, no, they said they really need to see you. And I'm like, okay, but you
What
understand,
am
I'm
I
like,
gonna do?
yeah, I'm like way over here. I don't see patients clinically right now, except in the context of a research study. Like,
Hmm.
I didn't remember why he had come to see me before, what we had worked on, or any of that. I mean, I kind of had this vague memory. So anyway, they're like, well, we'll send him over and you can talk to him there. I'm like, all right. I mean, I'm in a shared office now because
Hmm.
whatever. So, in the moment, in the time between the phone hangs up and the time that he arrives, I'm like, oh, like suddenly remember, like, oh no, like, and I had the thought too, Corinne, like he's coming to hurt me because he's okay. You
Remember
can't
that
tell this
profile you didn't put me on?
Right,
exactly
right,
right. Like,
Right.
or hey, you sent me out here again, and now that my symptoms were down, I wasn't as watchful
right.
or on guard, and
Yeah.
and then now it was even worse impacted, and I'm sweating this a little bit. You can't tell because this is an audio only podcast, but I'm a big person. Like
He's a
I'm
big person.
6'4". I'm not skinny, and I'm like I don't think of myself as a small person, but he made me feel like a small person because of how big he was.
Hmm.
Right. So he shows up to my office and I'm like, hi, I guess come on in. And
How's
he
it
actually
going?
just wraps his arms around me in this big bear hug. Right.
Aw.
And squeezing. So I'm like, words are better, like that. And invited him to come and sit down. And it was a similar kind of a thing, Corinne, to what you were talking about. Is he said, I really needed to come back and tell you, how important that was. That really set me up for success. Like I was really struggling before. I was doing so much better, and then I got deployed, and wasn't sure how that was going to go, and it wasn't fun. I still encountered some very difficult
Hmm.
experiences, but I felt like I had tools to deal with
Wow.
them, and I'm okay. Like I'm processing the stuff from the deployment, but I don't have PTSD. And it was
Which is
really,
exactly what we aim for, right? We don't aim
yes,
to make somebody like immune to trauma or immune
exactly.
to stressful situations. We aim to give them tools.
Yeah. And it was so rewarding and meaningful to me that this work matters. Like we don't always
Mhm.
get the rest of the story,
Yeah.
Right.
about how it impacts people. It was so nice to hear. And again, I like you were saying, Corinne, I didn't necessarily take credit for like he did the hard work
Hmm.
in treatment.
Right.
And it was like, gosh, this is worth doing. This is worth
Hmm.
sticking with even when it's hard. So that's kind of my story that
So that's the
reminded me of
impact.
Corinne.
Because my question was going to be, so how did that impact you?
Yeah. I mean, really that, right? Like this is, you can get into a slog in any work that you're doing. If,
Hmm.
whether it's CNP or whether it's doing PE back to back or what, whatever. And, and because we don't always get people returning and telling us how their lives went, sometimes it
Hmm.
feels like we're not sure if this is having the impact we're hoping it has. And I didn't
Right.
do like some big cross-sectional study to find out, but it felt really important that, like this wasn't just that he got a few points drop on the PCL and therefore we're going to call it an improvement. Like this
Yeah.
had this very clear, seeable impact on his life and his functioning in ways that, were extraordinary. And I don't know if this happens with every single person who does PE, but an awful lot do. And it was this great
Right.
feeling of like, this is worth our time, not just to generate RVUs and not just,
Hmm.
to get a few points improvement on a tracking instrument. Like this person's life was changed, and it
Well,
was an honor to be part of it.
and I think to that point, Kevin, one of the things that we can talk about with more confidence when we have experiences like that
Yeah.
is when you feel that pull to protect or to
Hmm.
um, somehow make decisions. Now, sometimes we're making decisions with, and there are times where we do need to protect, keep somebody in treatment or to stabilize them on a med. But that pull to like, ah, maybe I should like prevent him from going doing this
Yeah.
thing. How much more powerful it was for him to take back that territory and deploy with his unit
Yeah.
and see himself like it reinforced for him how, where he was and how different things were. And I feel like we get that a lot in I'm sure in CPT too, Corinne, but in PE, I think there's a lot of angst around that. So I think
Yeah.
what we tell people all the time, once you have the experience, it really shifts how you think and the confidence you have in the treatment. And it goes with the data that, there was some interesting data during that time period in OIF and OEF that if folks were medevaced out for mental health reasons, their outcomes were very
Right.
poor versus
Right.
if they could stay in
Yeah.
theater, get treatment, and return with their unit, that they definitely had a much better prognosis overall. So it's the
And
message we're sending, right? I mean,
Hmm.
right.
you're not
And
so fragile. You're not so,
Right.
you're not incapable. You're competent and capable and
Which is a
and-
really important part of all PTSD treatment, right?
right.
That
yeah.
we're being really mindful. This is what we talk about in all our workshops. We're being mindful that as the clinician, we don't want to set this expectation that you can't handle it as the
Yeah.
patient or that it's going to re-traumatize you or you're going to fall
Yeah.
apart.
And that a success is really about what's important to them. Like that's when I was worried that maybe getting this guy in a place where he could go deploy again was a bad thing, right? Or that it turns out
Hmm.
that's actually a good thing, right?
Yeah.
Like a lot of our service members want to do the job they trained to do. They want to feel like they're contributing to the mission. And so if I had been the one making that decision that, oh, well, no, you've been deployed 3 times and you have PTSD and you can't deploy again, that actually would have been a bad thing. That would have been a bad outcome for this
Right.
guy.
Well, and this actually, I will say, kind of segues into the story I was going to tell. It's variations on the theme.
Yeah.
Um, but I will say I had been working in a primary care setting. I love primary care work, integrated primary care work, and I had started a service in OBGYN, supporting women's health and loved it, was passionate about it, but it was grueling and kind of felt like I was treating full plate disorder NOS all the time. And really, there was so much going on in these peri and postpartum lives. And I then totally shifted gears. I separated from the Air Force and took my job with the Center for Deployment Psychology and had the opportunity to get trained in prolonged exposure down at Penn with FOA, sat through 4 days of training, which was phenomenal, but some pretty grueling videos, like a lot
Yeah.
of
Yeah.
Yep.
sexual assault treatment videos where I was like, I don't even know if I can do this, am I cut out for this kind of thing? But went back and luckily had the opportunity to have supervision and consultation, which was incredibly important as a neophyte prolonged exposure therapist. And I was working with a service member who was security forces who had done, 2 or 3 deployments, and came in, for PTSD treatment. And again, sort of felt like I was faking it till I made it kind of situation, and muddling through. Was I even helping this individual? He had a TDY, a temporary duty, where he had to go to another installation for a couple of weeks, and was sort of like problem solving around like, but wait, you're supposed, we need to see each other weekly. And I was trying to be really rigid with the protocol because that was what I was supposed to do. And we get to about session 6 with this little delay in time, so it was a little longer temporally. And he comes in, and I'm ready to kind of dig into whatever session it was, and his PCL had come down like really nicely. I mean, he was functionally doing more things and moving up his hierarchy and all the stuff. And I was like, let's dig in and blah blah blah. And he said, Doc, can we stop for a sec? And I said, absolutely. What's up? He said, I'm good. I think I'm good. And I said, well, you are doing a wonderful job. I'm reinforcing you are, and like, look at how much work you've done. And he just sat there and he's like, no, I mean, like, I'm good. I got this. I think I'm done.
He
And
fired you. He
he
fired you.
he he did. And but it was really interesting because I was a little too wrapped up in like I have to do the protocol. I'm supposed to
Yeah.
see you 10 to 12
Mhm.
sessions um and his scores were not all the way down by any means either. Like
No.
he was
Hmm.
still having some symptoms. And so we did have a really important conversation about is this avoidance, right? Because we always have to
Hmm.
figure out what's the
Sure.
function of the behavior. But the whole point he taught me was I'm supposed to not need you, right? Like if you've done your job,
Yeah.
I can take this forward on my own. I don't need to keep coming in here once a week. I understand approach, don't avoid. I understand I need to work my hierarchy. I understand, if I feel that urge to push away the memory of the trauma, it's okay to have that feeling, but like welcome it in and figure, keep processing this. And that taught me so much. Because I think sometimes, again, like what was the message I was sending him if I resisted
Hmm.
that was no, no,
Yeah.
no, you're not capable, you're not competent. We need to keep going. You're not quite there yet. And to
You
me
can't
that
function without
you
me.
can't function
And
without
I'll
me,
tell
right?
you when you're doing well.
E-
Right.
I'm the expert.
Exactly. Versus like, of course he should be in charge of that, right? And I will always remember that because I think sometimes we maybe as providers, because we want to be so certain and sure that our clients are the best in the best place they can possibly be, that we might miss opportunities to encourage folks that you got this. Like you're good.
I love
It
that.
really reminds me of the conversation that we had last season in our termination episode,
Mm.
which
Yes.
was probably one of the first episodes of season 7. The terminations, and how much we sometimes hang on to clients and don't listen to them and don't engage them in the discussion.
And I might have even told that story last season. But it was so good I needed to tell it again.
I don't think you did. I
I
mean,
don't think it did.
I don't
I
think you
don't
did.
remember.
I It reminds me too of another thing, and that is really not the place where it feels familiar is right when we talked about sins and that is that we're over relying on the protocol to tell us what to do for every step of the way, right? Like somehow we've enshrined the protocol
Mm.
as the cure or as the thing they need to do. Whereas I think it's important for us to remember, like, wait, this podcast is all about emphasizing EVPs and encouraging people to use
Hmm.
evidence-based psychotherapies and really, you know, thinking that this is a really important way to approach and to help people. And, we used to talk a lot about in earlier seasons too about don't forget that there's a real human being sitting there across from
With
Right.
you
a life,
with a life, with
a busy
lots of
life.
things going
Yep.
on, with lots of stuff they're dealing with that maybe
Yeah.
is or is not related to what we've been talking about. And so if we reduce therapy to checking boxes in a protocol, then we're not helping these people, right?
Hmm.
Like a protocol gives us a structure, like an idea of how to approach this, a way to understand what it is that they're experiencing, what their, presentation is, and kind of a structured way of approaching it. But it's not intended to replace you as the
Hmm.
therapist, as a human being in the room with them, having an experience with them. There's so much art that goes into that if you just throw that all away and say, well, we're gonna do the PE or the CPT or the CBTI protocol, checkbox, 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 you're not actually helping. So I it reminds me, I got a little bit of feedback from another listener a week or two ago. I'm trying to remember when it was, as we were talking a little bit about other things. And they said, I haven't listened to a lot of your episodes, but I worry that the impression is that everybody has to do EBPs or they're bad, or like it's kind of like shaming people in EVPs. I'm like, well, I appreciate the feedback. I don't think we're doing that, but it does remind me it's worth saying several times, right?
Yeah.
Like EVPs are important. That's the best stuff we've got. The research, the outcomes tells us that this is the best stuff we've got. Let's offer the best stuff we've got. And at the same time, don't forget that we're people and so are our clients, and like interact with the person in the room,
Yeah.
and
Mhm.
don't lose sight of that.
I have two thoughts about that. One is that it reminds me of something that our friend Andy Santinello always says, which is to remember to
Hi,
have,
Andy.
hi, Andy, Andy from Baltimore. Um, he,
Now they know where he lives.
I'm sure everybody's going to
They'll
go
go find
find
him now.
him. They're going to go
Yes.
locate him.
Baltimore's small.
Sorry, Andy. Anyway, he would talk about
Doxed.
flexibility with infidelity, and that's
Yes.
that's
Yes.
really the goal, to understand the protocol to have fidelity, but to know where to put in flexibility, which goes into my second thought, which is from Jenna's example, and actually yours too, Kevin, I fully respect that that's easy to say and to understand once you feel proficient in that
Yeah.
protocol. But when you are learning the protocol, I mean, even the way that we learn it with
Mhm.
consultation is check off, if we actually do say check off the boxes, did you do
Sure.
XYZ in session one? And so I also respect that there might be a little bit of an inherent mixed message in that, or a
Yeah.
necessary evil, that when you're learning the protocol, you need to be even more mindful about that
And the point
delicate
of my,
balance.
the point of the person I was talking to before is that, yes, like oftentimes EVPs are better than what somebody might be doing spontaneously, right?
Mhm.
And that's the point. Like it's helping us to develop those skills so that we have the expertise and the confidence to make
Mhm.
the flexible adjustments as we're working with that real human.
It's the framework. So, but what I
Yeah.
was going to say to Corinne's point was the beautiful thing at that moment was I had the ability to consult. So
Yeah.
when I was feeling insecure and when I was feeling, because we still had to schedule the final session and do some of the things we wanted to do to wrap things up. But I remember going back, Riggs was my supervisor, and saying like, "What do I do? This is happening," and him being like, "Let's break down what is he telling you? What's the function of the behavior? Let's look, or Ermold, calm down." And it was, I had already, started to head that direction, but it was really reinforcing to have the ability to consult and make sure that this departure, maybe slightly from the protocol, made sense. It was in the best interest of the client, who was the human
Mhm.
sitting in front of me, who wanted to get on with his life. So, which is the
Yeah.
overall outcome. Hey, I am mindful of the fact that we
Mm.
probably need to get ourselves over to actionable intel
Yeah.
from
Although we could
impactful
tell stories
moments.
all day, but we
We
should probably
could.
wrap this up.
Yeah.
Yeah.
Well, then, so let's talk about that then. Like we have three stories here. We've been talking about this for a while. Like what can we pull out as actionable intel, like we always do at the end of every episode? What can we leave our listeners with as some thoughts or tips or resources that they can take forward?
Incoming actionable intel.
I honestly think number one is asking yourself, what are those impactful moments that you have? Because as
Mm,
Yeah.
we've been
notice
as we've
them.
been chatting, yeah, notice them, because there are going to be plenty of times where you are slogging, like Kevin said, and you're just getting through the day and you're not seeing dramatic progress in that moment in your caseload. So being able to know what those moments are and refer back to them, I think is a really useful tool.
Yeah.
I think another one is we are, kind of as maybe we talked about earlier, we fall prey to the same biases that our clients do, and to remind yourself, like, so both of you, it wasn't the thought like, oh, this client's probably
Right.
here to see me, to tell me what a good job I
I
did,
know,
right?
I noticed that. We both
You
just
both
assume.
catastrophized big time, right? And so we need to be aware of that too, that I don't know until I know, um, and kind of keep it neutral, because my guess is you had a knot in your stomach, both of you, until it got resolved, and you didn't have to have that knot. It was not what you expected.
Yeah. And mine's, I don't know, maybe a mix of all those. It was, partly, like be open to having those
Mm,
experiences too, right? So I think Corinne, you said like remember those and bring them up when you're having a tough time, and Jenna, you're like, well, don't catastrophize necessarily, like, and similarly, like I guess I'm saying like be open to those meaningful, impactful experiences. They're happening,
Hmm.
right? And so like open
mm,
yourself up to to, I don't know, not, enjoying isn't really the right word, but like open yourself up to noticing them and making note of them, not kind of just swaying back into our own biases.
I like it.
This has been great to hear your stories and to have story time
Yeah.
together. I
Well,
think it's setting us up for a really great season 8. That wasn't
there you
even
go. We had to get
intentional.
the rhyme in. Yes.
There's no debate.
You're a poet and you didn't even know
Didn't
it.
even know it.
So yeah, we're looking forward to hearing more stories from our guests coming up in this season. We've got some really fantastic expert guests and topics that we've got lined up so far, and certainly looking for more. If you have great ideas about topics you want to hear about or questions that occur to you, or you've got maybe even some guests in mind that you think would be really fantastic you'd like to hear from, drop us a line.
Or an
Or
impactful moment.
Yeah.
or an impactful
Share
moment you
your
have.
impactful moments.
Do tell us if you leave us an impactful moment. Tell us whether you're okay with us sharing it on a future episode, because we'd love to do that too. We'd love to be able to share your impactful moments. De-identified, absolutely. Tell us like your first name, where you're from, that kind of thing. But you can send us an email. You can leave us a voicemail message on our speak pipe. Both of those ways to get in contact with us will be in the show notes. And as always, we would love to hear from you. We want this to really be a community.
Thank you for listening all this time.
Yeah, all 86 episodes.
Until the next one.
Stay curious.
And mind your EVPs.
Bye, everybody.
Bye, everybody.
Bye, everyone.
Be sure to subscribe to Practical for Your Practice to be notified when new episodes arrive. Our theme music is Failed Attempts by Nitro, and our administrative assistant is Bree Mercer. This podcast is produced by CDP at the Uniformed Services University of the Health Sciences. The views expressed are those of the speakers and do not necessarily reflect the opinions of the Uniformed Services University, the Department of War, or the U.S. government. In addition, references to any specific companies, products, processes, or services does not necessarily constitute or imply endorsement by the Uniformed Services University, the Department of War, or the U.S. government.